That's right. Dry as the Sahara. How did we ever get like this? It didn't used to be that way. Hi, I'm Dr. Rahman, and welcome to Menopause Unfiltered. Tonight, we're going to talk about vaginal moisturizers and vaginal lubricants. When do you use one versus the other? How do you apply it? And how do you know if it's working? Well, as we go through the perimenopause and enter into the postmenopause, the decreased estrogen levels can result in um, dryness in that area. And women will often say that it feels like sandpaper. Or when they're sexually active, they don't get as wet as they normally do. Or when they engage in sexual activity, there's not as much lubrication and the friction causes pain, which discourages um, women from engaging in any type of sexual activity because it's just too painful. And if that's the case, often the first thing that women can do is start to apply a moisturizer. And similar to applying a moisturizer to your face for the same reason to help to retain the water within the cells, you apply vaginal moisturizers and you apply it ideally nightly. Some women will just apply it every night as part of their beauty health routine. You apply the vaginal moisturizer to the skin around the opening of the vagina and also around the opening of the vagina. So around the vagina and around the opening to the vagina. And you do it on a regular basis. And sometimes just a regular application of a vaginal moisturizer is sufficient. And again, this will then become part of your routine. What you do, whether or not you're having or planning to have sexual activity. You're applying it so that when you do, things will feel better. There are lots of different vaginal moisturizers. They can be purchased over the counter. In fact, women will sometimes use coconut oil as a moisturizer. Vaginal lubricants are used during or at the time of sexual activity, and they're used to help to reduce the amount of friction or discomfort associated with the vaginal dryness. There's a slight difference in application. The moisturizer gets applied to the skin around and around the opening of the vagina. The lubricant gets applied to the opening around the vagina, and the lubricant gets applied to whatever is going into the vagina. The lubricant is used at the time of sexual activity. The moisturizer is used on a regular basis, ideally nightly. Really simple. These are non-hormonal options for women who are experiencing vaginal dryness, women who are experiencing vaginal dryness and who may want to be sexually active, but notice that there's way too much discomfort and they're not willing or ready to use estrogen. How do you know if it's working? That's easy. You should be able to feel a difference within 2 to 4 weeks of application. Until the next time, this is Dr. Rahman saying, Menopause Unfiltered. We're here to talk real talk about real issues. Send me your comments, send me your questions. I look forward to talking to you next time. And until then, be well.